Okay, so we've all seen what the Trump administration is doing across the executive branch with DEI. They're demanding private companies get rid of DEI. They are very actively trying to more forcefully return the United States to its white supremacist, white male patriarchy roots. Not that we were ever not that, but it's, and they want to go like all the way back up again. And we're seeing what Trump is doing to the economy, what he's doing to our international alliances, what he's doing with our international trade partners. I mean, it's just a litany of just incredibly bad ideas. The shit that he's doing with immigration and trying to do away with habeas corpus and due process, and we're in so many of these areas. We are now coming up on 4 months, and we're just running 70 miles an hour into a brick wall of the incompetence of all of these people. We all saw Kristi Noem try to define the term habeas corpus yesterday in a Senate hearing. And now, then that brings us to our nation's healthcare framework, where they're trying to do away with Medicare, they're trying to do away with Medicaid, just let people die, I guess. And then we have RFK Jr. and the people that he has brought along with him to head up things like the CDC and the NIH and the FDA. The FDA, which yesterday there was reporting in the New York Times that the FDA is planning to restrict access to COVID vaccines and strip away any requirement that health insurance companies pay for those vaccines, likely making them prohibitively expensive, even if the FDA has determined that you are eligible to get one. The Food and Drug Administration will permit the use of COVID vaccines by adults over 65 and those with certain medical conditions this coming fall, but may require additional studies before approving COVID vaccines for healthy Americans younger than 65 years old. They've been able to get those shots for the last 4 years. Every single person I know, except for a couple of people in my family, have had their vaccines and their boosters. Officials wrote, the FDA will approve vaccines for high-risk persons and at the same time demand robust, gold standard data on persons at low risk. What the fuck does that even mean? At this point, boosters offer uncertain benefits to many young people and middle-aged people who have already been vaccinated, okay, or who have had COVID. I had COVID twice, and each time it was a different strain. Until now, COVID shots were recommended for everyone aged 6 months and older, period. So we have anti-vaxxers in charge of our vaccines, which fits perfectly with the panoply of who is running the executive branch now. We have anti-vaxxers in charge of our vaccines. RFK Jr., the health secretary, is a longtime vaccine skeptic who spent years campaigning against COVID vaccines, claiming falsely at one point that COVID vaccines have killed more people than COVID. And we are also dealing with measles outbreaks. Laughter and Light earlier this evening put up a video saying that there had been a measles super spreader event at a Beyonce concert in New Jersey. The outbreak is spreading through Texas, and it's in 10 other states. And RFK Jr. has told people to treat their kids with lemons and vitamin A or something, kids who are unvaccinated, whose parents are vaccinated against measles, all the parents of these kids are vaccinated. And they decided not to get their kids vaccinated because reasons. And RFK told them vitamin A is a miracle drug when it comes to measles. So all these parents in Texas whose kids are unvaccinated started giving all their kids vitamin A to the point where they suffered vitamin A toxicity and were showing up to hospitals with liver damage. Little kids with liver damage. These parents ought to have their kids taken away from them at a minimum. I mean, the people who think that, so the people who, anytime a young, seemingly otherwise healthy celebrity or athlete dies, the people who immediately run into the comments on social media posts about that and say it was the jab. It was the jab. It was the clot shot. Those are the people who are now in charge of our federal health system and who are making decisions about vaccines for the rest of us. I mean, I said in my last video, it's like, will the nation survive another 4 years of Donald Trump? Will each of us individually survive another 4 years of these fucking clowns?